in this video, I'll be demonstrating how to do a complex wound care. So the first thing that I'll do is check my physician's orders for the dressing change instructions, as well as if there's any wound care specialist recommendations. And then I'll do hand hygiene and gather my supplies, which I already did beforehand. And then I'll do hand hygiene again and enter my patient's room, introduce myself, and make sure I have the right patient, and explain the procedure, as well as ask if they need any pain medications for the procedure. So hi, my name is Alex Cruz. I'm your 3 student nurse at the University of Manitoba. I'm here to change your dressing for you. Is that okay? Our patient agrees. Can you please tell me your name and date of birth? Mandy Myers, and PIN number is 123456789. It matches with the patient's the physician's order. And then, do you need any pain medication for the procedure? Yes or no? And then next, I will just take a couple of minutes to set up my sterile field here, if that's okay. I'll set this aside because we don't need it for now. And then I'll do hand hygiene and then set up my sterile kit. So we want to open the first flap away from us.
Not touching anything.
And then I'll put on my forceps right there. So actually, I'll use my forceps to pass myself the garbage. Next, is it okay if I put the garbage here? And then we'll also pass myself the sterile drape, which we will not be using. And then I'll set these aside for now, as we will be putting our normal saline in the largest container. And then we'll add in our supplies. So these packagings are open since I've used this for practice for this skills lab, but in the real life, we would check the packaging, make sure that it is intact, and our supplies have not been opened yet. And we also want to open away from our sterile field so that we don't contaminate it. And then we want to open with a banana peel method. I'll add on some extra 2x2s. So we can do the banana peel method and then drop that on to our field. We can also use our forceps to guide it out of the packaging. And then this one also would come in a paper packaging, and then we would banana peel it, but we have these in the lab for practice. So we'll drop that onto the largest compartment. And then we also have our 30 ml syringe for irrigation. And then our 20 gauge Teflon, so this would normally have a needle on it, but since I've already used this for practice, the needle's not on there anymore. But if it was, I would remove the needle and throw that into the sharps disposal. And then I would put extra scissors just in case. So now that's all set up, I would do hand hygiene again, and then put on a clean pair of gloves, and then we will remove the old dressing.
So normally we have to do
So we'll remove the old dressing, as well as the abs pad for 4x4 and acrylic, and then we would assess the whole dressing for the exudate. We want to know the amount, the color, and if there's any odor, and then we'll throw that into the garbage, as well as our dirty gloves now. And then we want to do hand hygiene again, and then prepare our sterile gloves. So we were done on the one for our dominant. Actually, before I don on my sterile gloves, I would also put my normal saline into my dressing tray. I would do this before I open the packaging for the sterile gloves, but since I forgot to do this, I would just do that right now. So we would be careful not to spill on our sterile field, and also because this went out of the sterile field, I would hit the call bell and ask the buddy nurse to grab me another Cathlon.
Yeah, she wants it. I'd probably get you to Maria.
Oh, good.
Okay, so there's our Cathlon. I would banana peel that and put that into my sterile field. And then I'll do hand hygiene once again. And then I would don on my sterile gloves, which I haven't touched yet, so it's still sterile. And then we can manipulate the things in our tray. So first, I would aspirate at least 10 cc of normal saline into my. Oh no, it's so bad. Okay, so we want to aspirate a minimum of 10 cc for irrigation, but in the clinical setting, we would do this. We would irrigate our wood until our irrigant runs clear, and then we would remove the needle. And then we would throw this in the sharps disposal later on. And then we would irrigate the wound from the center, the deepest part first, and then work our way outwards. And we would also irrigate the undermining. So we want to irrigate to the minimum of 10 cc. I'll irrigate the outer part of the wound. And then next is we'll dry our wound with our 4x4s. So I'll use my hands to make a rosette. And we want to dab once, and then throw that. And then grab another one and throw that out. And then we would also dry the undermining. We did not irrigate the tunneling though. So we'll dry the undermining, one dab, and that's it. And then now that our wound is clean, we can assess it. So we will use a Q-tip applicator. Actually, we also need to clean the peri wound. So we'll use 2x2s. And then we will dab that on our normal saline and then clean from top to bottom, from cleanest to dirtiest part. And we also go over the eschar and do it one more time. I was watching my forceps earlier as it came close to the peribone, but it didn't touch the peribone. But if it did, then I would restart the process, get a new sterile tray, and re-cleanse the wound. So we'll actually, this is dry, so we'll grab another one. So we cleaned one side, and then we will also clean the other side. So that in normal saline, we clean it, and then we would also dry it.
Remember the measurements or
So dry this side.
So now we are ready to pack. We will need a curlet. Also we need saline.
And dry the other side.
Oil. Use a forceps or Q-tip.
And then after it's all clean, we can assess the wound. We can measure the tunneling first.
Oh, I did remember we did have juice.
Actually, my tip touched the peribone, but I continued to insert it to the tunneling. But in real life, what I would do is discard this and get another Q-tip applicator and then use that to measure the tunneling. So let's pretend that this is, I've thrown out the old one, the one that touches the peribone, and then I would grab a new one and measure the tunneling. And then we want to estimate that with our ruler, so that's about 4 centimeters. And then we want to measure the undermining as well. So a rough estimate of about 3 centimeters. And then we want to measure the deepest part of the wound. So the depth is about 3 centimeters. And then the length is about 10 centimeters. And then the width is about 6 centimeters. And then we also want to assess the wound bed tissue, if there's any healthy healing tissue, such as granulation tissue for eschar or sloughing. So it looks like there's a small amount of eschar, moderate amount of sloughing, and a large amount of healthy granulation tissue. And then now we're ready to pack the wound. We want to wring out our Kerlex. And making sure not to spill on our sterile dressing kit, we're going to use the Q-tip applicator to guide our Kerlex into our wound. So we want to pack the tunneling, and then we want to make sure that our packing material or Kerlex dressing is not touching the peri wound. So we want to pack it adequately, but not too much that it causes pressure on the wound. And then we want to pack until all of the wound bed tissue is in contact with our Kerlex dressing.
It didn't get stuck in the garbage bag either. No. I only have one.
This one, we have a scissors to cut.
So my sterile gloves just touch this part of the patient's body, so I'd be sure to keep that in mind and make sure that that part of the glove doesn't touch my patient's wound.
For now, we can assume it doesn't touch outside. And now we can cover it over full. Dry. And now my wound is fully covered.
So if I accidentally touch the peri wound, we would remove this acrylic dressing, and then we would grab another sterile kit, redo the whole process, re-cleanse the whole wound, and then repack it. So it looks like I have an adequate amount of packing, just the right amount of packing in there. So I would use my scissors to cut the excess. And then this would go into the garbage. So make sure this part of the wound is also touching the packing. And then I'll use my 4x4s to cover the wound. Make sure that all the wound bed is covered. Then I would remove my sterile gloves now. And then cover our wound with abdominal pads. So this one, we can touch the outside part. And then we would secure that with a tape. And then we would do an outside safety check, clean up all of our supplies, and then we would document on our IPN for the wound care, the patient's tolerance, as well as the wound care flow sheet, as well as sign our mark if we gave any anesthesia for the procedure. That's it.